Thank you, Madam Speaker. A private company that's received more than $184 million in public funds over the last 8 years to care for vulnerable Nova Scotians is losing staff in droves. Ardent Client Care, for some reason, hasn't been filing taxes and didn't provide tax advice or T4As to its contractors. Now, a CRA audit has workers quitting in fear of financial ruin, and remaining workers are being asked to work 66-hour weeks to fill the gaps. Can the Minister of Opportunities and Social Development explain how this happened and why this government isn't making sure that companies paid with public money are following the law?
I recognize the Honourable Minister of Opportunities and Social Development.
Thank you, Madam Speaker, and thank you to the member for this important question. The first thing I want to do is reassure all Nova Scotians that their loved ones are getting excellent care to the standards that our department sets for them. That is first and foremost. To the suggestion that they're leaving in droves, that simply isn't true. Madam Speaker, that is a rumor, and I hate it when opposition spread rumors in this House. Madam Speaker, what I want to reassure all Nova Scotians, this is an issue between the federal government and the staff who work for this facility. And so if they have questions about CRA and their requirements for people to pay their income taxes, I would direct the members to speak with them. Thank you.
Is this going?
I recognize the Honourable Member for Cape Breton Centre, Whitney Pier.
Speaker, I have in fact spoken to some of these workers, and there is a CBC report that I've tabled. The Auditor General found that in recent years, this company has provided 83% of emergency placements for children in care. This is a major contractor, and there's been a clear failure of oversight from this government. The Department of Opportunities and Social Development requires a staffing ratio of 2 workers to 1 client. But now some Ardent houses are being staffed by only 1 contractor at a time. Workers say that this is a safety issue for staff and clients. What is the minister doing to ensure that workers are safe and clients have the care they need?
I recognize the Honourable Minister of Opportunities and Social Development.
Madam Speaker, I've said it before and I'll say it again. Words matter, facts matter, and saying things that are deliberately scaring the public is not acceptable. The care of all of these service providers is set based on the needs of the residents of those communities. If the requirement is for 2-to-1 staffing, that is exactly what they're getting, Madam Speaker. And there is a very robust process in place, both at the Department of Seniors and Long-Term Care, as well as at the Department of Opportunities and Social Development, to provide unannounced visits, scheduled visits, and an audit process that ensures that everyone is getting the care that they need, Madam Speaker. And we're going to continue to make sure that Nova Scotians, especially our most vulnerable, receive the care that they need.